Fabulous. Thanks, George. I'm very happy to be here and to meet with the committee. This is the second time we've met. We met with you through a public webinar about a month ago. The purpose of this panel is to talk about our perspectives on the purpose and use of LHIs, or a small level of high set indicators for the nation broadly, for both national and community needs. So I'll kick us off and then introduce our panelists as a whole, and we'll pass down the line. I'll remind people that we have no more than 15 minutes apiece, and I'll hold you to that. So that's my job on this. So thanks for the invitation. I'm really here in my capacity as a member of the Federal Advisory Committee for Healthy People 2030. I served as the chair for the subcommittees on approaches, which oversaw the development of the overall framework of the Leading Health Indicators Subcommittee and the Objective Review Subcommittee. And actually all the work from those subcommittees are highly relevant, I think, to the discussion today. So how did our group think about LHIs? Well, they're certainly the most visible component of the Healthy People program. And they really do represent key national priorities to catalyze action and stimulate a commitment of resources to improve health and well-being. They focus our attention, and the intent is to drive action. In the last meeting, we talked about the two-phase selection process that our advisory committee recommended, and I won't repeat that today because we've already discussed that. What I'd like to do is reflect a little bit on what we might learn about the use of LHIs from Healthy People 2020. Just a couple key points. One is, in Healthy People 2020, there were more than 1,600 objectives, and Dawn referred to that. 26 LHIs grouped in 12 topic areas. The LHIs really were used to communicate key messages, to really focus the nation's attention, and to tell success stories. In a sense, aggregating the 26 leading health indicators by the 12 topic areas, as Dawn also said, it was practical. There's 12 months in a year. Each month could be dedicated to a particular topic area. It provided a deep public dive in terms of where we were with a group of LHIs. So given the public visibility that LHIs had in Healthy People 2020, did we reach the goals for the LHIs in 2020? We were fortunate in our LHI subcommittee to receive a report, and you can actually go into the mid-course review for Healthy People 2020 and see that it's a mixed story. So even though these were the focused 26 leading health indicators, the mixed findings were 21% met or exceeded goals, 37% made progress towards meeting the set target, 25% had little to no detectable change, and 17% worsened. So those are the facts. There are probably different ways to interpret those facts, but those are the facts. So approximately 60%, more than half, we made progress or met the target, and about 40% we did not. Importantly, I think, and certainly relevant to Healthy People 2030 with our focus on health equity and health disparities, it's important to know that even if in Healthy People 2020 mid-course review, a target was met for the entire population, it doesn't mean that we should celebrate, because that doesn't mean the target is what was met for subpopulations in the nation. And that is absolutely crucial. I'll give you one example, and I'm an injury and violence researcher, so you have to live with my examples here. Let's look at the leading health indicator for Healthy People 2020 to reduce homicide from 6.1 to 5.5 per 100,000. In the mid-course review, it got a green check. We met that target as a country, but huge disparities continued to exist. So non-Hispanic Blacks, for example, was 22.8 per 100,000. So even though we met a target, we still have extreme disparities. And that rate becomes worse if you focus only on non-Hispanic Black men or certain age groups. So we need to make sure we think deeply and dig down and say, what is it that we want to accomplish? So what challenges do we foresee? And I speak again in terms of our committee. We foresee challenges based on 4 changes that we think are pretty significant in Healthy People 2030. First is the move in the framework and what drove everything we do from sole focus on health to health and well-being. Okay, so we added a new concept, and that will have issues for us to consider. The commitment to eliminate disparities, achieve health equity, and attain health literacy. So it's not reduce, it's eliminate, right? So that's a key part of Healthy People 2030. The third thing that we think is going to pose challenges is the significant focus on upstream determinants of health and well-being. That certainly was there in Healthy People 2020. It's much stronger, we believe, in Healthy People 2030. And also the rigorous application of data requirements to select the core objectives. As Dawn said, and as we talked about in our previous meeting, we have core, research, and developmental objectives. The core objectives really were framed to serve as the base for the selection of LHIs. There's now approximately 350, so I'm using round numbers here, core objectives as compared to the 1,600 in 2020. So it's pared down with rigorous data application. We found that in the review of the proposed set of Healthy People 2030 core objectives, that the preponderance focused on prevalence and on morbidity and mortality. It's possible that the potential LHIs that your committee may be most interested in and that will be most synchronous with the Healthy People 2030 framework are going to be constrained by gaps in the core objectives that address the focus on well-being and upstream determinants of health and measurement gaps. In reviewing the draft core objectives, the committee sees the potential gaps in measurement and address this with our recommendations, and you have that report with the 8 recommendations. Here I'll just highlight 2 recommendations that we think are essential. One is to add up to, as we review that draft set, that we think we should add up to 10 cross-cutting objectives that explicitly address the upstream determinants of health and well-being. And we need to add we recommended that objectives that directly address the structural and systematic prejudices and discrimination through law, policy, and practices be added. Those, I think, are the two of the 8 core recommendations that if they result in a different final set of core objectives will be helpful as you think about LHIs, and if not, you're going to have to think about how you live within the constraints of the core objectives. So we're hopeful that the final set of core objectives address these recommendations, and time will tell. So with that, I will end my comments, and I'm going to pass the baton. Actually, I'm going to introduce everybody at once. How's that? And then we can be quite efficient. So our next speaker will be Anita Chandra, who's Vice President and Director, RAND Social and Economic Wellbeing, and a Senior Policy Researcher, affiliated faculty, Party RAND Graduate School. We also have Bobby Milstein, who's Director at Rethink Health. And we have Soma Stout in absentia because she's in the airport in Philadelphia. Her plane was rerouted. But she is Vice President of the Institute of Healthcare Improvement and Executive Lead on 100 Million Healthier Lives. And luckily, she was co-presenting with Carly Riley, who's an attending physician in the Division of Critical Care Medicine at Cincinnati Children's Hospital Medical Center and assistant professor at the University of Cincinnati Department of Pediatrics. So I'll turn this over to Chandra and remind everybody 15 minutes max.